Okay, everybody right to go? Well, thanks for joining us this morning. I know Minister Foley's been through the COVID update, but I just wanted to point out nearly 21,000 tests is such an impressive number, and I want to thank every single Victorian who's come forward and got tested these last 36 hours or so. We're heading towards a week of not only zero cases, but perhaps more testing than we've done for quite some time, and that is a very impressive thing, and it means that we can be clear on where the virus is, where it isn't, and put a public health response around every single person who tests positive. It really does give us great confidence that because of the sacrifices and the hard work that every Victorian has made and done, we can keep these numbers very low. So it is a very impressive thing to see so many people come forward and get tested. Beyond that though, today's not so much about COVID, it's about dealing with one of the biggest challenges in terms of public policy, the services that matter to every single Victorian, and that is making sure that our mental health system, instead of being broken, as it has been for a long time, a series of services that don't properly connect, not really one system, a sector, a part of our health system that fails so many people every single day. There is no health without mental health, and the investments that we've made over our now nearly 6 years in office are a point of pride for us. But what's even more important is an acknowledgement that this system needs to improve. It needs to get much, much better to save lives, to change lives, to make sure that every single person who lives with mental illness, their carers, their loved ones, have got the dignity and access to the services that they need when they need them. This does change lives, and it absolutely saves lives as well. And there are many things that have been exposed, if you like, throughout the course of this year. The pandemic has really cast a very bright light on many failings in many different parts, or many weaknesses in many different parts of service delivery across our state. I am pleased to say, though, that it didn't take a 1 in 100 year event for us as a government to realise that we needed to do more and we needed to do better in terms of mental health. Prior to the 2018 election, we committed to have Australia's first Royal Commission into our mental health system and to accept those recommendations, to deliver those recommendations. Its final report will come down in February, but we can't wait until then. We need to make sure that we get on and make the investments to deliver all the recommendations from the first report, build a system that actually supports people, works for people who have got mental illness, their carers, their loved ones. The benefits, we all benefit from that. Every single Victorian benefits from a much better and stronger, a more resilient, a more responsive mental health system. Not individual services, but connected, one proper response to give people the care and support that they need. That's why the budget, to be delivered in just a couple of weeks' time, will include almost $870 million in new funding for more beds. So $870 million in new money for more beds, better treatment, better care, making sure that everyone across the community who has a mental illness can get the care that they need when they need it. This is important at a very personal level, but it's also something that we all benefit from in terms of productivity, efficiency, all of those things. But ultimately it's about changing lives and saving lives, and we're proud to be able to provide this additional funding. More beds, additional services, particularly suicide prevention services. It's about fully delivering each and every one of the recommendations that the first report of the Royal Commission gave to us. And then beyond that, it's also about waiting until February when we get the final report. But this is about a massive expansion in the services that are so important for so many people. For too long, the mental health system has not received the share of funding, the amount of support, the dedicated effort that we know is so important to better outcomes for everybody. 1 in 5 of us will experience a mental illness this year, but 5 in 5 of us benefit from a better mental health system. And this massive investment is just one part of how we'll deliver that for every single Victorian. I'll now ask the Deputy Premier and Mental Health Minister to run you through where this money will go and some of the features of it, and then we're happy to take any questions you have.
Great, thanks Daniel, and good morning all. So we've got the twin wicked challenge of a mental health system that is broken, and this year dealing with the impact of a global pandemic and all the stress, the isolation, being apart from loved ones, and the impact on people's mental health. So now, more than ever, we need to invest and reform in our mental health system. As Daniel said, we commissioned the Royal Commission, and it will bring down its final report in February of next year. But we're not going to wait, and we can't wait for February next year. This is a massive mental health budget and a down payment, if you like, as we prepare for the final report of the Royal Commission next year. $868.6 million, almost $870 million in total. And the centrepiece of this budget is the delivery in full of 144 mental health beds, and that is over and above the 135 beds that was recommended in the Royal Commission's interim report. So that's made up of $492 million to deliver 120 beds in Sunshine, Geelong, Epping and in Melbourne, 16 beds in Geelong, 52 in Sunshine, 30 in Epping and 22 in Melbourne, and those designs are being released today. We made an announcement earlier in the year of 24 hospital in the home beds, and again that will be split between Barwon Health, so 9 beds in Barwon and 15 beds as a partnership between Origin and Melbourne Health. And then in addition to that, there's $18.9 million for 35 acute treatment beds in private hospitals for public patients. So that's 179 beds in total, over and above the 170 that was recommended in the interim report of the Royal Commission. So that is the centrepiece of this year's budget that we'll hand down in a couple of weeks, but there's a lot more that we're doing. There's going to be $21.4 million to complete the expansion of our HOPE services. These are post-suicidal support services, and we will complete the expansion in 2021. So we will cover regional centres and services right across metropolitan Melbourne, so we'll have statewide provision of this post-suicidal support. As we fix the mental health system, one of the key themes and recommendations out of the Royal Commission so far has been to learn from the experience of those who have lived with mental health, who have lived with the service, lived both in a personal way and in the services that was provided. So we're going to respond to that in 3 ways in this budget. Firstly, there's $2.2 million for the design of the Victorian Collaborative Centre for Mental Health. If you think of it, we're trying to replicate for mental health the Comprehensive Cancer Centre in Victoria. So $2.2 million for the design. We'll engage with academics, researchers and those with lived experience. There's also training and employment pathways for people with lived experience, and I talked about that yesterday. And finally, there's $8.7 million for a residential mental health service, which will be designed and delivered by people with lived experience. There's going to be $20 million allocated to upgrades for state-owned facilities, and there'll be a grants program to deliver that. Importantly, there'll be 19,000 hours, additional hours of community mental health support. And that's almost a $26 million investment. And that goes to the demand. You know, we've got to meet the demand now as we have our eye on the future with the Royal Commission. So almost $26 million for 19,000 additional hours. There's almost $48 million for early intervention for young people. And this will be support directed at young people suffering from severe mental illness and psychosocial disability. So that's a significant investment. Finally, there's a lot more in the budget, but finally in terms of the highlights today, there's $7 million for the new Origin Centre, both in terms of the critical research work that they do, as well as their operations. So all in all, this is a massive package of almost $870 million. We need to do this now because our system is broken and we're living with the impact of the pandemic. So we need to make this investment now as we look forward with anticipation to the final report of the Royal Commission in February, and of course post that report There'll be more to say and there'll be more to do, but we've committed to delivering on every single one of the recommendations of the Royal Commission.
Yeah, it is. It'll be thousands and thousands of patients, and if you then go beyond that and think about carers, loved ones, families, because of course, just like physical health, if somebody in your family is unwell and doesn't get the care that they need, doesn't get the support that they need, they've got a system that almost works against them. That doesn't just impact that person as a patient or client, it affects everybody in your household, and indeed by extension every single one of us. When you think about people who aren't at work, people who are needing crisis care because they're not properly supported to manage their mental health as part of a treatment plan, as part of staying well, when the system's designed to only really be there when someone's in absolute crisis, that's not a good system. So there will literally be tens of thousands of people who will benefit from these additional beds, these additional outreach services. And just to pick up on something that the point James made, putting those who have lived experience, those who have a history of mental illness, those who are clients, consumers, whatever term you want to use, putting them at the centre of designing a new system just makes sense. They know and understand the failings of this system and its strengths. They know what's needed, they know what will work, and giving them a voice and putting them at the centre of this reform and investment agenda is exactly what the Royal Commission told us to do, and it's exactly what we're getting on with. Yes. Oh, well, look, if I can put it to you this way, James, I think the final report will recommend even further investment. There's no doubt about that. And it'll cover off some areas that were not covered. So the sort of rhythm to this was the first report was things that couldn't wait, that we should get on with, and there'd be a bit of a time lag. Because you can't just build a bed, you've got to have the physical space, you've got to recruit the workforce, you've got to do all of that. So that was kind of, while we're finishing the bigger part of the report, you get on and do this. So we have, and in fact we're well and truly above that. The final report will canvass all sorts of other issues, many of which may take years. It's not something, there's no switch to be flicked here. This is a long term, you've got to be determined, you've got to be focused, you've got to make the investments, and that's what they are. They're not costs, they're investments in saving lives, changing lives, building a system that actually works, and making sure that we have, through what I think is the best process in our nation, a proper investigative process to come up with all the best of ideas, with a will and an absolute determination to each year, every year, build that system. There's many more years worth of investment here to come. And look, we would have the report a bit earlier if it weren't for the COVID, but I think giving the Royal Commissioners a little bit more time, I'm confident they'll hit their deadline in February, and there will need to be significant investment beyond that. Yes. Well, in terms of all of the expenditure that we've announced to date, and we'll continue to announce right up until budget day, that'll all be brought to book when the budget's handed down. Sure. Well, there'll be different timeframes for each of them. Some essentially are being purchased from the private sector, and that's been a feature of our initial response. Others will need some capital upgrades and things of that nature. But the Minister might be able to speak to the rollout and when those beds will be available.
So in terms of the 120 mental health public beds, which are focused in Sunshine, Epping, Geelong and Melbourne, we'll have the tender go out by the end of this year and construction by the middle of next year. So we announced the fast tracking of the design and the planning earlier in the year. The pandemic has had an impact. Health services understandably have been focused on responding to the pandemic and recovery, but we're moving as fast as we can. We'll have a tier 1 contractor delivering the 4 projects at the same time, so as one project. We've centralised the design process, so we're moving as quickly as possible, but out to tender by the end of the year, construction by middle of next year. Yeah, they are. So for example, in Melbourne, it's Royal Melbourne, Sunshine Hospital, so they're attached to existing services, but these are brand new, purpose-built newly designed. You know, we're marrying up, taking up the findings and the recommendations of the Royal Commission to make sure that these beds, these facilities look very much different to the facilities that we've had for the last 20 or 30 years. Well, as we've said, that'll be part of our response to the final report. So the final report of the Royal Commission's February. There'll be no further announcements in that space for this budget in 2 weeks' time. We'll respond next year. Now is not the time. Now is not the time, and there's been discussions with the Royal Commission. We'll have the final report in February. We'll respond, as we said, to all of the recommendations. We will deliver on all of the recommendations, but now is not the time. We'll deal with that next year. Each initiative is rolled out on a different timeline depending on its complexity, how quickly we can get it out the door. But for example, the Hope services will have complete the expansion of these post-suicidal supports by the end of 2021. So we'll have some absolutely completed by the end of this year. We'll have the remainder next year. So they all vary in terms of the timeline, but the level of investment that you're seeing in the budget that we'll hand down in 2 weeks shows how committed we are to meet the demand now, as we at the same time have an eye to future reform that will come out of the Royal Commission. Work on all of the initiatives will be, we will get to it straight away. There's work that is happening right now on the expansion of the Hope Centres, on support for asylum seekers. So work happens immediately. Exactly when each initiative is rolled out, when the grants program, for example, for the 20 million of upgrades, when that rolls out, that will be at a certain time of the year. So we'll roll it out through the course of the year, but the imperative is meeting the need that is out there, and that's why this investment is so large.
As the Premier said,
well, it's the service that wraps around the patient or the consumer, though the partnerships with other service providers. So these are dedicated mental health beds. The facilities look different. You know, you can imagine someone suffering severe mental illness. The facilities do look different. So we need to design it, but we're designing it today in partnership with people with a lived experience. With mental health practitioners, with experts as well.
as the Premier said earlier, it's not just a matter of setting up the beds and facilities. You've got to have the staff to provide those services. Often those are highly skilled positions. How confident are you that of sort of being able to ramp up that workforce?
Yeah, it's a good question, and you are absolutely true, and that's why part of the announcement that myself and Luke Donnellan and Gabrielle Williams made yesterday in terms of the recovery workforce, 130 of those are in the mental health space, from doctors, so from psychiatry registrars, to mental health nurses, to retraining existing nurses in mental health, getting the graduates coming through the system. So you need to have that pipeline from encouraging and supporting graduates coming through the system to getting those experts at the top end of their profession into these services. So it is absolutely critical, and that's why you saw the announcement that we made yesterday, and I think it will be one of the core themes that will come out of the Royal Commission. In terms of where and how many beds, that's still to be determined. So the commitment that we're making in this budget is $8.7 million. But the commitment is, and this is in line with the Royal Commission, it'll be designed and delivered for the first time through people with lived experience. So this is incredibly exciting. Incredibly exciting in terms of the detail that will come through the design and planning over the next 6 to 12 months. Yeah, that's right. So it will be a partnership with an existing organisation, but it will be designed and delivered by people with lived experience. Yeah, and it's not. It's important that this investment is not just focused on at the acute end at the mental health beds. It's also what we're doing right now in terms of support for counselling services. So you saw earlier in the year significant additional support for Lifeline, Beyond Blue, almost $30 million of investment in our schools. The early intervention that we're talking about in this budget. So it's about what can we do immediately to ease that pressure, because we are seeing increased presentations at ED. We are seeing, of course, particularly during the lockdown period, a significant increase in tele and video conferencing for counselling. But we are making that investment, Richard. It's at the acute end, it's at the early intervention end, it's counselling, it's support for those organisations. So we're getting rolling updates. We're getting rolling updates in terms of how do we compare to the same 6-week period earlier in the year. So we are seeing around a 5% increase in ED presentations. It's a high percentage for young people. We're seeing increase in counselling services. The latest coroner's report is out this morning, and it shows that death by suicide is comparable to same time last year. In fact, the latest data is that we're slightly lower. Every suicide is an absolute tragedy, but we are about 20 lower than this same time last year. So we're not seeing it reflected in the death rate in terms of suicide, but we are seeing an increased demand for services, and we expected that. We knew that would happen, and every single week the Department of Health and Human Services is engaging with about 18 mental health service providers to get a real-time awareness of the impact of demand and of particular services, and we're responding to that information that we're getting in a real-time sense.
Just on the coroner report that came out this morning, I know you said that it's 20 down at this time of year, but it was slightly up in June or March, April, and around August, so then it can be that it's high. And particularly, there's a slight increase in men under the age of 18 and over the age of 65. Are you sure that you've captured those people? Obviously, I'm not concerned with you actually going forward. Are you sure you've captured those people?
So it's careful to approach that data, because a small number of people can have a big difference in the percentages, and the coroner's report goes to that point, particularly in regards to men over 65 and children and young people. So overall, the number is comparable, and right now we're slightly less than this time last year, but. You know, we need to make this investment. I go back to the point I made at the start. Our mental health system is broken, plus we're dealing with a global pandemic. And that's why we're making this massive investment to this budget on the 24th of November. And that's why we will respond comprehensively to the final report in February next year.
Separate. No, that's not what's going on here at all, and I'd direct you to the relevant minister, and if we need him to clarify those matters further, I'm more than happy to arrange for that to happen. No, I haven't. And I wish those who do only good things. When there's no changes here that are negative in any way. I'm more than happy to have the Minister speak to you about that. Well, this is an ongoing process and I'm not going to try and answer those questions for IBAC. It's a very important process and it should be allowed to run its course, and I'm just not going to be a commentator on that. But of course I stand by the answers I've given on these matters and similar matters previously.
There's been significant questions raised over the last couple of months since IBAC stands and the layout of the big sort of government MPs, our ex-government MPs as well, and there are further questions being raised about the truthfulness of your testimony or stating that you provide the assembly at the end of this week. I just think Collins deserve to put ourselves in more than items without him telling the truth.
Now, what Victorians deserve and what Victorians will get is the IBAC process running its course without me trampling all over it. It needs to run its course. It's an important process, not just this matter, any matter that comes before IBAC. Very important that it's done properly, and I've got complete confidence that IBAC will do their job as they should, and they'll provide a final report and we'll be able to talk about that. And indeed, there may well be action coming out of that.
About the evidence that's being given or against Paul Richards, or about the evidence that's being made around
I know Pauline Richards to be an outstanding person, someone who works very hard for her community, someone who lives in her community, understands her community and is passionate about delivering for her local community. And at a personal level, I know her to be a person of absolute integrity. Beyond that, I think we do need to be careful not to be straying into essentially trying to run a process that sits alongside IBAC. They've got a job to do. Evidence has been led. They'll work through that. They'll hear from witnesses. They'll do all of that work, and then they'll have findings. No, I haven't, but I think as Minister Pakula made it clear yesterday, the Victorian Government Commissioner effectively in Shanghai has spoken with the National Development and Reform Commission, so that's a national government body, very significant body in China, and made the point that a positive relationship is very important to us. We export the best products in the world of their kind, and we wouldn't want to see any barriers to us exporting not just what we used to export, but indeed new products and more of the same products, because that's all about jobs. So I haven't done that, but I know that those who work for us, both in market and here, have made those important representations, just as I'm sure the Commonwealth Trade Minister has done the same. Well, I think it's, there's lots of views on these things, but I would hope that you'd all at least credit me with the fact that I've always been pretty focused on having a good relationship, not for its own sake, but a good relationship so more Victorian product goes from Victoria to China. They are our biggest customer, and I have long held the view, and nothing will change my view, that if you treat your biggest customer with absolute respect, you don't have to agree on everything. You can have differences of opinion. But if you don't treat them properly, if you don't value that important trading relationship, well, they won't be your biggest customer for very, very long. Whether it's China, the US, EU, it doesn't matter. The ultimate thing here is to work through things in a respectful way, never take a backward step, never. Be assertive about the things that you believe in, stand up for yourself always. But a good relationship is all about jobs. It is all about more product going to China or to any other country. Doesn't mean you have to agree on everything, but you've got to have a relationship that has a degree of respect and mutual understanding, otherwise there will not be mutual benefit. That's certainly no benefit for us.
That's like a good relationship or having a respectful relationship. It's not really helping log exports.
But this is hang on. This is rather a strange line of inquiry. Let's be very clear. The Commonwealth Government can speak to their partnership and their relationship with that country and every other country. They're rather keen on this exclusive arrangement where they get to do all this work and no one else can get involved. So if it's not in a good place, I don't know why anyone would be looking at me or us to try and find a detailed explanation of that. I think that there are others who can answer for that. There are others who can speak to that, and I wish them well. If we have good relationships at a national and a sub-national level, then that means more jobs, means more product being exported, more economic opportunity, more businesses thriving in our state and right across our nation. That's what I want. I'm sure that's what Minister Birmingham wants. I'm sure that's what the PM wants. But as to any changes in that relationship, I would direct you, with the greatest of respect, I would direct you to the Commonwealth Government. I think they're uniquely placed to speak to that, Rich.
Speaking of businesses thriving, we've had 13 days of zero.
Yes.
CBD businesses are among those most adversely affected by the lockdown, largely because office workers
Yep.
aren't back at work yet. How soon will we be able to see that funding given that we are in a pretty bad situation?
Yeah, look, it's a very important question, and it's a really big challenge for us to get that balance right. I can't today give you a date when we will have CBD workers, but not just CBD, other office workers who can work from home. The notion of when we can lift that rule, if you like, that if you can work from home, you must work from home. I know it's very frustrating, but I can't give you a date. But hopefully we'll be able to provide some further updates and hopefully a sense of a timeline, perhaps, when we make other announcements on the 22nd, and we're well on track to be able to make all of those changes we foreshadowed very recently on the 22nd, and hopefully talk a little bit more about what the rest of November and what the run up to that COVID normal Christmas looks like. And if we can, with any certainty, speak about some of the settings as we move into 2021, of course we will.
And in terms of borders,
Well, we'll just have to see how things go. The most important thing here is that we've got to have, as we've always done, we've got to have enough data so that we've got the most complete picture, and that when we make assumptions, they're based on the very best evidence. So I'd love to be able to make all those announcements this Sunday, but these announcements are spaced out in 2-week blocks because that's kind of the life cycle of this virus. And I just say again to every single Victorian, every single person who's interested in these matters, and that's all of us, even 13 days of zero cases is not the same as a vaccine. This thing will still be lurking out there, smouldering if you like, and we need to make sure that we're vigilant and that we do take the steps, yes, but do it in a safe and steady way, a cautious way. You know, stay safe, stay open. It is exactly as it says. It is all about steady, safe steps. That means we can find that normal and lock it in, and then appropriately defend it throughout the course of 2021.
in terms of borders, Victoria's borders are obviously open, but
Yes.
state borders with us aren't yet. There are calls, given that we've got zero cases, to call for that New South Wales border reopening to be brought forward, and Queensland as well. Do you have any view on that?
Oh, look, I'm not about lecturing other premiers on what they should do. Ultimately, we've got a very good partnership with all other First Ministers, and we've seen announcements in recent times about New South Wales. We've seen some foreshadowing from the Chief Health Officer up in Queensland. The Premier of Tasmania's made some positive announcements very recently. I've always said our greatest contribution to these border issues is getting our numbers low and keeping them low, and that's exactly what Victorians are doing, and I'm grateful, I'm proud, and what that means is all those foreshadowed deadlines, they'll be able to be met. I'm not interested in having debates and arguments with other premiers. Just let's get the job done, and we are. And that's why we're going to see these borders open. And the goal's always been get to the end of the year and have the country as one unified country where we don't have these borders. And I think we're well and truly on track for that. And I'm sure that'll be a feature of discussions at National Cabinet tomorrow.
And do we have a date yet?
No, not as yet. There'll be some discussions, I think, in broad terms, not necessarily about our reset, but there'll be some broad terms discussions about quotas, return travellers, and the national agreement and aim to have as many people back by Christmas as possible. But we'll make further announcements in terms of our detailed response, our comprehensive response to the first report. Oh, it's absolutely fantastic to have more than 20,000. That's 2 days running. Wednesday, each of you monitor this just as I do. Wednesdays is often a very big day. To exceed that again on a Thursday is just terrific. We had the best part of 25,000 tests over the course of the weekend. Victorians are coming forward, and even with the mildest of symptoms, they're getting tested, and they're getting tested quickly. Those exposure days are coming down as well, so people are doing exactly what we've asked them to do, and it's a fantastic thing. It is the key in many ways to keeping these numbers low. Getting tested as soon as you've got symptoms, as common sense tells you and our experience tells you, we can find you quickly. We can wrap a public health response around you, your family, and therefore every family. If you're protected and not giving it to anybody else, then you're not just looking after your family, you are essentially doing the right thing by every single Victorian family. Because it means that just we pull it up, it doesn't spread, and then we can keep on opening up, and we can keep people well. No one wants to get this. Doesn't matter whether you're fit, young, healthy, pre-existing conditions, elderly, doesn't matter. No one should be in any doubt. This is not a good thing to get. It is not a good thing to get. So we've all got to be vigilant, and the great news is everybody is.
Do you have any detail on what's been done behind the high testing?
Well, we're doing some sentinel testing, so we're doing some testing, but that's a small portion of the overall. The vast majority of these tests today and each day are people coming forward, having heard the message literally thousands and thousands of times. If you've got symptoms, even mild symptoms, come forward, get tested, and don't delay. Do it today. And that's a deeply impressive thing, that people are coming forward and still doing that in such strong numbers, and we've just got to keep those numbers up. We'll have more to say about some changes to testing, some further testing. That's not for today, but we'll have those announcements to make soon. Yeah. I'd need to get Victoria Police, I think, probably not the Minister. I'd get Victoria Police to come back to you on that. But they're going to be out on the weekend, and that's a really important thing. They've put a lot of work in to do that in a COVID-safe way. And yes, a bit of reporting today about traffic volumes being up again. I think there's a lot of short trips being done. It's my personal experience. The Monash is not anywhere like it would normally be. So the notion that we're back to normal traffic, I don't think that's right. And we might have some more Google data for you later on today about that. But when it comes to road safety, pandemic or no pandemic, this is very, very important. And things weren't possible because of where the pandemic was up to. But now we're in a position where Victoria Police, with all the right planning and a vigilance around safety for their members as well as members of the public, they can be out there doing that important road safety work this weekend. Yeah. Oh, look, and I welcome that today. That's fantastic news. If we've got products that have got efficacy at sort of 90%, we've got timelines as early as March, that's a fantastic outcome if we can get to that. And anything we can do to help with that, I'm sure that'll be a part of tomorrow's National Cabinet discussions as well, about how we're already doing a whole lot of planning work about how we will literally provide injections for millions and millions of people. So our health department's doing that work, and that's a partnership with the Commonwealth. I don't know that we would necessarily have a roadmap that was predicated on that. I think we've got the assumption has to be that it'll turn up when it turns up. Like we can't necessarily factor that in because nothing's certain. It could be though in a month's time, as our further clinical trials, all that gets proved up, that then we can be more certain about how many doses will be here, how effective it is, when. And how long it'll take to manufacture, how long it'll take to actually administer. I don't think we're quite at that point yet, but hopefully we can be. Yes. Samaya, my views on our relationships with China and dozens of other countries are well known and very well understood, and I don't necessarily think I'm going to be running through all of those reasons again. What I'd say to you is the fact that the relationship is not in a good place is hardly a reason to go and make it worse. It just doesn't make any sense. I would direct you to some comments that Andrew Liveris, a very well-known business leader, made at the National Press Club recently. It was an excellent speech, and he went directly to this, and I think that it's not just me or politicians from one side or the other. People in business, whether they be very small businesses, larger businesses, food, fibre, sort of agri-business, all the way through, doesn't matter what product it is, they are our biggest customer. We should never take a backward step. We don't have to agree with everything, and we don't. And there are ways to push back on things. But at the end of the day, you've got to find a way, and we always have done best when we've found a way to have a trading relationship and a diplomatic relationship, and to try and pursue those things forcefully, but effectively. And I don't think that's beyond us. We've done it before. and we can do it again. I don't think, in my humble opinion, I don't think that we'll necessarily get to that place by ripping up MOUs or fixating on sister city arrangements. I think we have many bigger priorities than that. In my humble view, it's just as a lowly premier who, you know, wouldn't dare to be involved in anything like trade policy. I just hope people in the federal government are getting their calls returned. That's what I hope, because this is about jobs. It's about real people, and no one wants to see any Victorian product unable to be exported to that country or any country. We've all just got to find a way to repair whatever damage has been done. And it's not about fault or blame, it's just about being focused on the thing that matters most. And that's not posturing and it's not politics. It's jobs and livelihoods. That's what I've always been focused on. Well, the status of those agreements, the federal parliament are dealing with those things, and I'll wait and see what comes of that. But you know, if it is the view of the federal government or the federal parliament that we should have less agreements with trading partners rather than more, then they can explain why that makes sense. The logical extension of that is, of course, well, CHAFTA. What's the status of that? You know, this. I think that there's been a Senate process. I'll leave you to reflect on that. I could, but I choose not to. I just think we've got many bigger priorities, many bigger things that we should be focusing on, and one of them should be getting as much product from Victoria, from our country, to every part of the world. And whether people like it or not, China is a very big part of that. They are our biggest customer. We can have a forceful relationship, a mature and respectful relationship, push back when we need to, absolutely. But we can also have a partnership that's in our interests, that's absolutely in our interests, to export the best product, to create more jobs and support literally hundreds of thousands of people. That's what we should be absolutely focused on. And look, to their credit, despite all the posturing and all the stuff that gets written and said, I'm pretty confident that that's what the Prime Minister wants to achieve, and that's what Simon Birmingham wants to achieve. And if we can play a part in that in any way, not just now, but at any time, of course we're always working hard to get more Victorian product around the world.
You made reference to the federal government getting their
No, I think when I spoke to Rich earlier on, Minister Pakula has been engaged. Our Commissioner in Shanghai has been engaged. I haven't. I've been rather focused on other issues.
And are they getting their calls returned?
Oh, yes. The Labor Caucus. I'm not a member of the Federal Labor Caucus. Well, my view is that I'm always a bit sceptical when people start describing who does and doesn't support us. I think that, you know, there's an awful lot of views about that. This notion that, you know, people in high vis don't vote for our side of politics. That's just wrong. That's absolutely wrong. What you've got to do is have a progressive agenda, a logical agenda, and you've got to have a plan to get things done. And that's exactly what we've done here for the last 6 years, and it's what we'll continue doing. And then it'll be a matter for the Victorian community, whether they wear high vis or not, whether they want to keep creating jobs, making big reforms. I don't agree with some of the commentary that's come out of Canberra these last few days about, you know, various groups in the community that used to be with us and now they aren't. I think that that's just unhelpful. The opinions of a very small number of people that I don't think are backed up by the evidence.
Isn't it easier to say that your European parties are perhaps more infrastructure than the mining states with
Well, I'll leave that to others to. Every job is important, but so's being honest about the fact that the world is changing, and there's an awful lot of jobs in alternative forms of energy, and you know, you can get into this kind of denialism. This, oh well, it's not real. I'll just tell everyone what they want to hear. That's not leadership. That's nothing like leadership. What you've got to do is make the transition and back the transition to work. We will have a lot more to say about this sector. We think renewable energy is a very big part of the economic recovery. It's that multiple benefit. Jobs never been more important, but it's also about making a transition to a lower cost, sustainable and cleaner energy mix, and having the kind of energy security and certainty that industry needs, that households need, that businesses need. I think you can do that. You've just got to work really hard. You've got to get out there and be frank and honest with people. Climate change is real. Carbon emissions are real. The notion that you can pretend that that isn't a fact is not leadership. It is not leadership. If you're not tackling these issues and turning these challenges into opportunities, then you're not leading. You're doing something very, very different. Very different. Anyway, there's my thoughts on federal elements within federal Labor, which I'm sure I probably shouldn't have done. But anyway, thank you very much. Thank you very much. And Albo's doing a fantastic job. Thank you very much.